Good evening and welcome to I'm Chris Parnell.
Reporting from Moscow.
Tbilisi, Times Square.
May your dreams be your only boundaries in life.
Hello and welcome to Living Well. I'm William Kinley. Methodist Le Bonheur Germantown Hospital offers an outpatient rehab program that features physical, speech, and occupational therapists. These therapists can help people recover from a variety of injuries and manage medical conditions. Ellen Markwell is a senior physical therapist with Methodist Le Bonheur Germantown Hospital. She has 25 years of experience and has worked with a wide variety of patients. Ellen, we're glad to have you with us today.
Thank you.
Thank you for being on Living Well. So I guess a good place to start, you're a physical therapist.
Yes.
What kind of education do you have to be a physical therapist?
Physical therapists have a 4-year undergraduate degree. Prior to joining any physical therapy school that's a certified school, and then when you finish with your physical therapy schooling, you will have a doctorate in physical therapy.
So how long is physical therapy school?
7 years. So physical therapy is 3 years, so 7 years total to reach your degree, and then you have to sit for boards and have board certified. Okay,
so it's a 7-year. It's not that dissimilar from being a physician, really.
Well, different courses.
And a little bit shorter, but
yes.
Still 7 years is quite an investment. What drove you to the field?
Physical therapy, I think there was some natural talent being in the athletic world of different things, and just have always been around people, and have always known that knowing maybe a little bit of what I know can help somebody else has been always a driving force.
Sure.
So
Well, that's a good way, so I know you have great passion with what you do.
Yeah.
So tell us, there are lots of different folks with different backgrounds that work with patients and with athletes. A lot of push today is all of us are trying to either lose weight or gain weight. Lose weight in my standpoint. A lot of folks have personal trainers. What's the difference between a personal trainer and working with a physical therapist?
Well, a lot of times, people just assume as a physical therapist, what can I do to exercise? And the science behind formulating somebody an appropriate exercise program is knowing what they should do or what they shouldn't do. And so our training as a physical therapist includes a lot of anatomy and physiology and science behind that. The idea is to know what issues that are red flags, and what you need to be doing. And so a lot of exercise is formulated because of our evaluation. So the schooling that we have and then what we do, so there's a science behind why the particular exercises that we do, or stretching or whatever.
Well, that makes sense. So if a physician sends a patient to you, so it's not like they're ordering a prescription per se. They're sending them to you to be evaluated and then a treatment plan. Is that correct?
So as a physical therapist, we always evaluate a patient. A lot of times people will say, can you just give me exercises for my back? And I'll say, I don't even know what you can or can't do or what you should or shouldn't do. And so part of that we're looking at is formulating that with what the physician's diagnosis states, and then evaluating the whole patient. People come from all different walks of life, different ages, different medical conditions that may precipitate doing certain things for you. And so that's part of our job, is to knowing what to do personally for you that's different. It may be back pain, but it may not be the same for everybody. So a physician can count on the fact that a patient will come be evaluated, and then we'll set them up on a custom treatment plan that's specific for them. What do we do for them in our physical therapy clinic, and then what do they need to do as a home exercise program? So it's about what we both do for the best management of a person's condition.
So really more of a team approach, I guess.
Totally.
Has that changed during your 25 years of experience?
How we approach treating people, now there's a lot of, with insurances and different things that regulate numbers of visits. We need to be honest, certain people have certain amount of very high copays as things have been done, and people just say, I'd love to come further, but I can't afford it. And so you have to respect that and appreciate how we approach and direct that with people. Everybody can count on the fact that we will listen to their history and then evaluate what's going on. And part of it is understanding. I tell people it's almost like peeling an onion skin. We're going to see what you don't have to help us see what you need to do.
I see. So what are some of the reasons people need physical therapy?
People, it's funny, when people think about physical therapy, a lot of times they think it's the athletic world, that it's, athletics and that type of thing. But we see people for neurological conditions, we see people strokes, back pain, balance disorders. We happen to see all adults, but there's children that do that too. We don't do that at our department, but there's all kind of different diagnoses that are specific. Shoulder pain. So it's
really across the board. So you work with these different types of patients. Give us kind of an overview or of a lay of the land of different things that you do.
Well, it's interesting. You work with patients and you work with patients' families. So part of what we want to always make sure is that we are focused on what all their needs are. So we're good listeners. We have to be good listeners for that, but then to execute a plan that's appropriate for them needing skilled therapy. And that plan goes along with what that person is going to do to manage the best. A lot of times I'll ask people, what are your goals? And they'll say, I want to get back to normal. And a lot of times it's a new normal. And so we have to help them find that new normal of how they move or how they shouldn't move and any adaptations for that.
Do you ever have to work with anyone that maybe their pain is a result of how they move, and they have to adjust how they're going forward in order not to recreate that pain over and over and over again?
Totally. A lot of times, when somebody is specific about, say, instance, a golfer, there's a whole different world. A person that enjoys golfing, if their golfing is limited because of their back, they're very much on board because their golfing has been affected as opposed to they just have arthritis in their back. And so it's very interesting on how you have to customize of what to do. And so maybe specific stretching or things to do that attends to their issues so that they can better do their functional activity in life. The whole idea is to get people back to a healthier life. And if we can get you doing, if it's your sports activities, if it's your golfing, if it's your gardening, we want to know that we can do to help integrate that to a functional
Well, that was
return.
kind of my next question around how have you improved patients' lives, but you've really hit upon that.
Well, a lot of people come because they hurt, and what we want to do is identify the symptom causing the pain. And so we back up and say we want to treat your problem, not your pain. And so as we go, we move people to a point that they can get back doing different things. Again, maybe adapt it a different way, or attacking it at a different time span to returning to different things. But in an educated, an objective way to get you to that point.
That's great. Thank you.
So, thank you.
It's time for a quick break. Up next, we're going to talk with a physical therapy patient who has had a knee replacement as well as a hip and shoulder replacement, all within a year and a half. We'll hear her story and why she believes physical therapy is so important. We'll be right back.
Okay, Josh, do your stuff.
Okay, people, you know the drill. Canned foods only, guys.
Sometimes you gotta live what you believe, open your arms, 'cause that's where it starts. Right here with you and with me. I know well, needs now is love.
Generosity, pass it on.
A little help from up above. Fit to me.
A message from the Foundation for a Better Life.
GHS-TV has a new website. You can now view any of our shows on our new media pages. Or check out the latest Wake Up Germantown or Red Devil postgame. As always, we're streaming live 24/7. Just visit ghstv.org today.
Welcome back. We're talking with senior physical therapist Ellen Markwell, and she's here with one of her patients, Ann Forsey. Welcome back. We're glad to have you with us.
Thank you.
So you've had your knee replaced and your shoulder replaced and your hip replaced all within a year.
Yes.
And you just race right up here and you can talk to us now.
Oh yeah. Just
So,
no, I'm doing real good.
well, you obviously
Real
are.
good.
You're moving great.
Yes.
So what was that like over the last 12 months? You've been in the hospital and in rehab
Constantly.
a lot of time. Yeah.
Yes. But I was in so much pain before. This is wonderful. So it's released. I don't have any pain, but I'm
So
learning how to make everything work right now.
So you're through the pain.
Mm-hmm.
Are you more mobile than you were before?
Absolutely. I spent 2 years sitting on the couch. I couldn't move.
Now, did you have the same surgeon for all of these?
I had Dr. David Lavelle for the hip and knee,
Mm-hmm.
and Dr. Throckmorton at Campbell Clinic for my shoulder.
So, and then you went on into rehab
Absolutely.
with each of those. And I'm sure, or
Absolutely.
I would guess, that each one of those is a little different.
Totally. Totally.
So your first one, I guess we'll kind of go through. Was the knee the first surgery?
Hip was the first one.
Okay.
And
So we'll just work through it. So what was that rehab like?
well, it was real good. And it was the best one.
It was the best one. It convinced you to do the others.
Well, I didn't know how good it was until we did the others.
I understand.
But
that was
it
your
was-
baseline.
Yeah, it was really good. I was so amazed at how fast I could walk and do things again.
Now you were in the hospital how long for your surgery? Was it a couple days, 3 days,
A
maybe?
day or two.
And you were up probably if not that afternoon, the next
Oh
day.
yes,
moving,
you're walking before you get out.
and then right into rehab.
Yes,
Did you go to an inpatient facility
No.
afterwards? So right
went
to
straight
outpatient
home.
rehab.
and then rehab.
That's awesome.
And yeah,
So then we get to, was the knee next?
shoulder was next.
Shoulder was next. Okay. Now I have heard shoulder rehab can be kind of tough. Is that true?
It's rough.
Rougher
rough.
than the hip.
Oh yeah.
Well, you were probably immobilized for longer, weren't you?
My shoulder, yes,
Uh-huh.
absolutely.
Uh-huh.
And I think that's part of why it takes so long
Mm-hmm.
to get going again.
So
But
how
I was
that
home by
different?
lunch after the surgery.
I see. But then you're in a sling for a while.
12 weeks, right?
12 weeks.
12
I've
weeks
had friends
in a
that
sling.
have shoulder surgery and they say you get really, really tired of your sling.
Oh yeah.
So
think
then
I
you
threw it
started
away when
then
I
you
got-
started rehab.
Yes, and it's a slow process. The muscles do not want to work again after that, so you have to work on that a lot.
Did you come kind of the same kind of schedule and to the outpatient, and you worked with Ellen on all of these, right?
Angela has done all
with
of
Angela.
them.
So Angela was working with you.
Yes, she's fabulous.
So Angela, you were hip, and then you're to the knee, to the
the
shoulder. What are the big differences?
There are huge differences with all of them. I mean, they're all major surgeries, but with a hip replacement, that tends to be thought of as the easiest one. You tend to get moving faster. A shoulder replacement, the shoulder joint is so complex that when you have such a complex joint, you're going to have a complex rehab. The knee replacement is known as the most painful replacement of all of them.
So really more so than the shoulder.
Anne may say different, but she might be our first patient that we've had that has had all three done in such a short amount of time to compare it.
She seems to, I would trust her opinion.
Absolutely. Absolutely.
You're the
Well, I've
only
had good
one
care.
You're the
I've had
only
good
one I
care.
know. That's awesome. So Angela, you're a physical therapy assistant.
Correct.
So you work with Ellen,
Yes.
and then with Ann's surgeon with the plan of care after the assessment and all that we heard before.
Right.
How many weeks of rehab did you have?
Well, it was, I don't know, it was at least 12 for the shoulder.
Okay.
So I assume about 12.
I see.
But I think the shoulder was the most.
So a good portion
We're
of
still
the,
working
of
on
last
it.
year.
No, I'm not either. I'm out of rehab. I'm doing the impact now.
What tell us about that. So you're out of rehab.
Mm-hmm.
So now you've continued on.
Yes, because number one, I didn't move for 2 years hardly. So then after all of this, I have got to get my body back to moving, used to moving and doing, I have, strength and stamina and endurance, and my goal is to be able to go on vacation with the family.
Well, it looks like you're well on the way to me. So tell us more about this post-rehab, the program that you call the Impact Program. Angela, do you want to start?
I would love to talk about it. In Ann's case, she finishes with her rehabilitation, and then she moves into a program at the same facility at Methodist Germantown, where she is not being seen under therapy or rehab, but she is seen in a medically supervised way by myself. I'm also a personal trainer in addition to being a PTA, and so I know her medical background. I know the things that she has going on. I know how to work with her shoulder, her hip and her knee, and her other arthritic joints, knowing that she has also been on the couch for 2 years. It's my job to make her more functional to get to that 100% after skilled physical therapy is over.
I see. So how frequently do you come for the Impact Program in a week?
Twice a week.
Okay. And do you do anything outside of the Impact Program as well?
I do. I try to keep doing exercises, and I just do more moving.
So, I mean, you probably couldn't give us a better description of where you were before. You say you're a couch potato. We've all been there. We know what that means. But can you give us a little more about how your life's different now?
Well, there's no pain. That's the wonderful thing. My pain was so bad I couldn't stand it. So.
And you're moving a lot more? You're doing more things?
I do. I absolutely, I go shopping. And I go places. Before I never went anywhere.
I think the interesting part too was that Ann's family has said such a difference that they have her back. So from her grandchildren's activities in their school, to functional lifetime things with her church, to other things, people don't feel limited with Ann, and she has just adapted everything that we've told her and applied it in a functional way to get her best health.
I see. Well, Angela, how many folks do you have in the Impact Program?
And currently I have 18 people in the Impact Program.
Okay.
These are all people that have been patients with us at Methodist Germantown in our department. And so I have a pretty good history of their medical background, and they come 2 times a week for 6 weeks, and they can continue that for up to 36 visits to get to the maximum benefit to where then they can go out on their own and exercise.
Thank you so much for being here and sharing your story.
Thank you.
We certainly appreciate it. Still to come, learn the difference occupational and speech therapy can make in some people's lives. Stay with us.
High School, an international baccalaureate creative and performing arts optional school, a destination school for students who are going places.
Our students are of the highest caliber when it comes to their academics and knowledge.
The IB program is a very rigorous program.
You were challenged in a way that you thought you couldn't be challenged. You succeeded, something that other kids may not have thought they could do.
They're accepted to colleges that are just, dream colleges for so many people.
Germantown High School offers a CAPA program, the Creative and Performing Arts program.
When I first came here, I saw the television studio and I was just amazed at what all I saw.
Kids do everything, that they're taught every detail that has to do with theater arts and creative arts.
I love a lot of things about Germantown High School, but primarily what I love is the athletics. There's something exciting around every single corner.
We probably are one of the most diverse high schools in the state of Tennessee, maybe the United States.
I would never doubt about sending your child to Germantown High School.
This high school is something not like any other high school that we have.
There's definitely fun in the work. We find fun in everything we do.
Welcome back. Ellen Markwell, Senior Physical Therapist with Methodist Le Bonheur Germantown Hospital, and Angela Wingfield, Physical Therapy Assistant, are here with us, and we're going to talk a little more about another program that we have at Methodist Le Bonheur Germantown, and that's the Stroke Support Group. Can you tell us about that?
I'd love to. The Stroke Support Group at Methodist Germantown has been going on for 11 years now, and we have about 20 to 25 people that show up for this support group every month. It meets the first Tuesday of the month at 4 p.m. in our department on the campus of Methodist Hospital Germantown.
I see. So I understand strokes are very prevalent in our community.
Absolutely.
And so it affects a lot of folks. Can you tell us how the support group works, how we got involved, how it got started?
It actually got started, I started it 10, 11 years ago because I myself had a stroke. And when I returned to work, I found that talking to my patients was the best support that I could get. And with my coworker support, decided to start a support group. And it has been extremely successful. Support groups are vital to recovery. It is so important for people to see beyond the physical limitations of a stroke and see what's going on with the caregivers and help them through that process.
So do most of the participants in the support group, are they folks that have come through rehab for therapy or not always?
I would say half are from rehab, but we get people throughout the community that come to the support group.
Okay. Some self-referral and I guess know people?
Absolutely.
Word of mouth gets out there?
Word of mouth gets out there. They hear about it and they want to check it out. We provide valuable education about everything from vision problems after a stroke, depression, anxiety. We have outings where we go and we're going to go play miniature golf. We've had tennis clubs to where people that don't have use of one arm can still learn how to play a sport. We do a variety of things, and they get an opportunity to see that they are not the only one out there, whether they're the caregiver or the survivor, that there are people out there like that, like them, and they get to have that vital social support.
So tell us a range of ages that you have with stroke. I mean, you said you had a stroke yourself, and
yes.
you're a young person.
Yes.
So do you have a broad age of folks that are involved with the support group?
We have a very wide range of people. We have anywhere from 35 years old to 85 years old. The interesting thing about the support group is when you walk in, you see people that have had strokes that you may not see their limitation. Their limitation may be their speech, or it may be cognitive in nature. It may be that they can't feel one side of their body. And so that's the silent struggle that they're going through as to why they need a support group.
Well, that's wonderful. What a wonderful community service.
Thank you.
Would you like to tell us so we can share with our viewers how to get in touch with the stroke support group?
Absolutely. They can contact us at our department. It's 901-516-6929.
Very good. Thank you.
Thank you.
So both of you are physical therapy, but rehab is broader than physical therapy. We've got occupational therapy, we talked about earlier a little bit, and speech. Could you give us an overview of kind of what are those therapies and how does that fit into rehab?
Well, again, these are board certified through an educational program that's specific for those particular vocations, occupational therapy schools, and then the speech pathology school. And so they each have their own background of where they come from, but everybody, when you are through those certain specific educational requirements, then you are able to evaluate a patient and then treat them and set them up on a plan of care just like we do.
I see.
Angela, it was interesting talking about the people about speech therapy. If we can talk about speech therapy first, William, the speech therapy, people don't think about speech therapy in the way that you think of something besides just your ability to articulate something. People have communication issues, whether it's from a stroke or from other issues of cancer and radiation and different things that they may be referred for voice disorders. So she not only works with people with their expressive language, but also their receptive language. So that may be high-level thinking. memory tasks, swallowing. They may be working with people with swallowing. They can do objective testing where in the hospital they can have specific like barium swallows, modified barium swallows to know that can they swallow or not so that they can be taken off a peg tube for eating. So they are involved with all kinds of things as opposed to just articulation.
I see. I see.
So
probably really help with a lot of frustration, I would think, with patients that would have those challenges.
It's very much so, and as Angela says, sometimes it can be a silent issue. There was a gentleman that was a very high-functioning manager at a local business that we had, and he was able to return back to his job in a different manner after his stroke because of going through cognitive. He could walk, he could move all 4 limbs, but he could not remember certain things, and she developed strategies for helping him to not be so tense and stressed about getting back to doing his job.
That's a great success story. Now, occupational therapy, I will tell you, some folks, and even I, when I had first heard of occupational therapy, is, well, you're going to train me to do a job. Explain what occupational therapy really is.
Again, after they evaluate you according to your certain medical conditions, they set up an exercise program or a program involving different strategies for work ergonomics, etc. You may have had an amputation, and they are going to work with you to get adaptive equipment to teach you how to dress yourself, how to do the normal functional activities of daily living that get you being as independent as possible. It may not be back to your normal. Again, it may be your new normal, but what do you need to do to be able to do that? And they do work with adaptive equipment and other strategies to be able to return to that.
Is it frequent that all of the specialties are working together with a patient?
Very, very often that they may come and they may have just 2 of our disciplines, and it may just have all 3. But certain diagnoses come for just one of us, and some may come for whatever's needed. But it's wonderful to have that offering that not many places of outpatient clinics offer.
Well, just last question, if there was one thing, if you're going to be a patient and come from rehab, what is the one thing that you need to come with to be successful?
Motivation.
Okay.
You can count on us giving you 100% of a thorough evaluation, and with the best evidence-based practice, we will get you on a program for that. So you come with the willing spirit and determination, and we can get you through it.
That's great. Thank you both very much.
Thank you.
Thank you.
That wraps up our show for today. I hope that living well will help you and your family lead healthy lives. Thanks for watching. I'll see you next time.